If you have chronic neck pain, I want to talk to you about 5 secrets to help you release that chronic pain once and for all. This is not for you if you've had an acute injury and you still need to see a physiotherapist or medical professional so that you can get an accurate diagnosis. And this is not for you if you have numbness or tingling through your arms or through your neck or face. However, if you do have chronic neck tension and pain, this is important for you to listen to educate yourself so that you can be inspired to get rid of it once and for all. So the first secret is know where you are positioned in space. If your neck is directly over your shoulders in a way that your ear is lining up with your shoulder, then you are in fact releasing the effort that those neck muscles, extensors and stabilizers need to exert to keep you stable by multiple points. And so it's really important for you to understand where you are in space and to use your deep neck flexors with a gentle chin tuck, lengthening through the back of the neck, not over tensing to find that, so that you can gradually build on that so that feels normal to you. But know that it won't feel normal right away. My daughter's doing airband guitar over there. It's not going to feel normal right away. And so finding that periodically, using the mirror and using your chair. The second tip is understand that your upper traps are kind of part of your neck. So the fascia goes all the way up to the base of the skull. And because we often will bring our shoulders up as we bring our arms up, bring our shoulders up as we bring our arms forward, we are chronically tensioning those muscles. So if we can find strength through our back, and if we can dissociate the movement through our arms and our shoulders without bringing that up all the time, then we reduce so much tension headaches. I will often in the clinic use a combination of dry needling as well as clinical Pilates to help you get a sense for how that can feel in your body. So number 3, we sometimes have dural nerve tension through the spine and tension through the spine itself. So finding a nerve glide and a regular nerve and spinal glide so that we can come into this range of motion, extension and flexion, and trying to really find each segment of the spine through that movement that will release some of that tension and glide those nerves so that we're not feeling the tension through the nerves as pain throughout the upper body and neck. Number 4 is understanding also that our necks are tension flexors, are stress flexors. So if you have ever been in a very stressful meeting or stressful conversation, you might notice that everything kind of comes forward and up. So how can we interrupt that? It's an art. It's difficult to do that. But if we can have the presence of mind to maybe put a heater on our neck when we're going into a call where we're not going to be seen, or if we can have the presence of mind to lean back in our chair when we are in a meeting that is causing us stress, then we're going to reduce again that fatigue and chronic tension through our necks. Ergonomics are really helpful for this. The last thing that I want to talk about, so we have talked about positioning, centering like Jenga blocks. We've talked about dural tension. We've also talked about understanding the component of upper trap involvement as well as understanding how stress is involved. So the last thing I want to talk about, which actually happened to me, is knowing that sometimes we stop moving our neck because we're afraid to move it. So finding safe movement can be huge. So every hour rotating into a safe zone, extending and flexing into safe, pain-free zone is really important for the synovial fluid mechanoreceptors to secrete it. Thank you.